Welcome, everyone. Thank you for joining us today. I'm Teresa Marentat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 611,424 confirmed cases of COVID-19 in Canada and 194,232 cases in Ontario. Chatham-Kent has 776 cases and Sarnia-Lambton has reported 999 cases. Michigan now has 502,119 cases, with 26,152 cases being in Detroit. Today we are reporting 174 new cases of COVID-19 in Windsor and Essex County. 25 cases are related to outbreaks, 4 are household contacts of confirmed cases, 2 are community acquired, and 143 cases are still being investigated. We continue to reach out as quickly as possible to advise people to isolate. 105 people were reached yesterday and 26 so far today. We have had 8,676 cases since March. 6,035 cases are now resolved and 2,471 cases are active. 102 people are currently in the hospital with COVID-19 and 15 people are in ICU. There are 134 suspect cases of COVID-19 in our hospitals. We are reporting an additional 3 deaths today, people from the community. A man in his 60s, a woman in her 70s, and a man in his 80s. Our community has lost 170 people to COVID. 108 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 47 active outbreaks in Windsor and Essex County, 21 in long-term care and retirement homes, 18 workplaces, 2 schools, 4 community outbreaks, and 2 hospital outbreaks. Vaccination of residents, staff, and caregivers of our long-term care homes continues. 2 more homes will be vaccinated today. We continue to work closely with all of the homes to get people vaccinated as quickly as possible. Despite the rollout of the vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. With the vaccine rolling out in long-term care homes and retirement home for residents, staff, and designated caregivers, I want to take this opportunity to identify the priorities for vaccination at this time. The Government of Ontario has identified 3 phases for the vaccine rollout. Phase 1, which includes high-risk population, and they include residents, staff, essential caregivers, and other employees of congregate living setting, which includes long-term care home and retirement home that provide care for the seniors as they are at the higher risk of infection and serious illness from COVID-19. The second set of priorities under Phase 1 is healthcare workers, including hospital employees, other staff who work or study in the hospitals, and other healthcare personnel, based on a risk prioritization matrix that is focused on the risk of COVID acquisition and the risk of severe illness and death from COVID-19. As more and more vaccine become available, more and more healthcare workers will be prioritized to get the vaccine. The third priority is adults in Indigenous communities, including remote communities where risk of transmission is high, and the fourth priority is adult recipients of chronic home health care. In Phase 2, essential workers will be targeted, and essential workers are those who are contributing to the maintenance of essential services for the functioning of society, such as police, firefighters, other employees maintaining key services such as electricity, water, gas, internet, grocery store staff, etc. The other group would be identified as adults, starting from seniors in the 80s, 70s, and then in 60s, and at-risk population, which includes correctional facilities, work settings, agricultural facilities, meat production, packing facilities, congregate living settings, including shelters and migrant quarters. And then the rest of the general population would be included. All of these priorities are contingent on the supply of the vaccine, that how quickly it is coming to us. If we are getting more vaccine, more priorities can be targeted. If we are getting less number of vaccine, even sub-prioritization will be is happening at the direction of the different task force working groups working throughout the province and locally as well. Many of these priorities are broadly defined and developed by the province, and then locally we refine it based on any challenges with what we are seeing in the region. Knowing that Windsor-Essex region is hardest hit in the province, with right now with almost half of our long-term care home and retirement homes in outbreak. And while planning for the vaccine rollout in this scenario is challenging, we also recognize the importance of taking timely action to protect our most vulnerable people. We recognize that there is not enough scientific evidence to vaccinate residents and staff in the long-term care homes and retirement homes that are in outbreak. But what we did is we looked at similar evidence from other credible scientific bodies, expert opinions, and our local expertise to develop local parameters to vaccinate the residents and staff in the long-term care home and retirement homes. I am pleased to report that we have provided our local guidance to the long-term care homes and retirement homes that are in outbreak to start vaccinating the residents based on these parameters. Vaccines can be offered to individuals with no contraindication to any of the available vaccine, which is Moderna or Pfizer. When it comes to residents, the residents that are negative and are in the affected unit, they can get the vaccine. Residents who are in the non-affected unit, they can also get the vaccine. Previously positive COVID cases who are considered resolved, they can also get the vaccine at this time. When it comes to staff, there are some minor differences when it comes to staff, recognizing that the staff are going from one patient to another and potentially at risk of exposing themselves or others for COVID. So any staff who is negative and who never worked in the affected unit at this time, they can get the vaccine. Any staff who are negative but who are not identified as a high-risk close contact of a confirmed COVID case, they can get the vaccine. Any staff who are on a leave of absence due to outbreak concerns, but they are planning to return to work immediately after vaccination and supported by their employer, can also get the vaccine. Any previously positive COVID cases who are considered resolved among staff, they can also get the vaccine, but consideration can be to defer their vaccine for at least 3 months post-resolution when there's a supply concern, vaccine supply concern, which we may see in our region shortly. When it comes to caregivers, all caregivers who are negative and are not identified as a high-risk close contacts of a confirmed COVID case, they can get their vaccine. Having said that, there are certain situations when vaccine should not be offered to individuals, which includes anyone with acute febrile illness or severe acute infection, anyone with active COVID disease, anyone who failed the active COVID screen on the day of vaccination, and anyone who is suspected of COVID at this time. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. How does it feel that you're now able to vaccinate people with homes in outbreak, knowing there are so many with outbreak, even with all of the considerations that you just mentioned?
Well, I think it's a balancing risk, and we always try to work for our residents, identify what the issues are, look for the scientific rationale, scientific evidence to provide recommendations, and in the absence of a clear scientific recommendations, what we do is we rely on the evidence from either other credible authorities, expert opinions, and our local expertise to make those decisions. So this decision, while we set up those parameters, it should help to protect our residents. And we're confident that this way we will be doing more, we'll be saving more lives, and that's why we carefully looked at the risks and benefits of everything that we have put together in these parameters to ensure the safety and well-being without jeopardizing anyone. And it's to me, I think it's a good thing that we can do that, and hopefully we should be able to get all of these people vaccinated in a timely manner.
And I meant to ask this yesterday, but because of the question constraint, I couldn't get to it. Why did the health unit stand by its statement that it was going to begin vaccinating long-term care residents on Monday, when you did in fact begin many days earlier on the Friday? Even the holiday news release that came out on the topic didn't clarify that you had begun vaccinating. So why did you not tell the public that you were beginning earlier than you had stated publicly?
Well, I think one of the main criteria every time when we are talking about the vaccine is often direction from the ministry in terms of what we can and what we cannot share. And most importantly, recognizing that these vaccines are a very precious commodity at this time. And ensuring the safety and protection of these vaccines is critical. And based on all of these logistics, we felt that it is important that we take this safety consideration to the heart, as we have always done. It doesn't matter what people are thinking. I think it's critical that we are making all these decisions for the benefit of our community without putting anyone at risk, including our staff or including anyone who is involved in the entire process. So we feel that that was not the right time to share that information. We now have some experience in terms of how all these vaccine rollouts are happening. And we said that that's why we always say that your health unit have done, and again, maybe it sounds self-serving, but your health unit has done an amazing job in terms of staying on top of many things with the region of our size, with the capacity, with the resources that we have, with the expertise that we have here. We have accomplished many things that some of the major health units with much higher workforce and much resource have done. The decisions that we have made, the accomplishment that we have made, it's almost at times are leading the way for many of the other health units to follow. So I think it's just providing that same level of comfort, and want to say to the community is we are working literally nonstop, and we're always thinking about how we can do better for our community with all the constraints, with all the challenges that we have. And maybe at times it feels that maybe we are not doing what you expect us to do, but have faith, we are doing a lot. There are many things that we share on a timely manner. And some of that is, again, based on the various restriction challenges that we have to keep into consideration, being the public health unit and working with different levels of the government. But rest assured, we're working nonstop to find solutions to every problem that you are thinking. We are on top of all of those questions that you might be thinking at this time, and we'll continue to do that, continue to serve our community, and get on with the vaccine and everything that comes our way.
So for clarity, Doctor, did the health unit intentionally publicize a later date for the beginning of the vaccination than you knew you'd be able to start the vaccination for security purposes, to avoid people showing up? Or did you publicize the date you thought you were going to start, and then you were able to start earlier than you expected?
Well, that would be the latter. So we publicized the date that was in the plan based on the information that we had, but then we as we said, that the moment the vaccine got into our building, we worked really hard to see how how we can even save one day. And our team worked really hard with some of the early adopters, and then we were able to roll that out. So yeah, it was not intentional to to confuse people or to say that we are delaying it, but that was the original plan. But just like everything in COVID, we plan, but then if there is a better option, we go with that.
Okay, thank you.
Any questions from AIM 800?
I just got one, sorry, I just got on the call. Doctor, I'm not sure if this has been answered yet, but when it comes to the vaccine, do you know where we're at for, and I know the hospital takes care of the staff for long-term care retirement homes, but I'm hearing the staff at hospitals have got the vaccination. Can you confirm that?
Sorry, Rob, I think I missed that question. So you're asking how many hospital staff have got the vaccine?
Yeah, or have the staff at hospitals received the vaccine already? Because wasn't it long-term care retirement home staff originally?
So with the first priority, yes, that's the long-term care home and retirement home staff, but also there are, so for example, you have a vial which has, it's a multi-dose vial. And if you have some extra vaccine that are left, so instead of wasting it, and if you don't have the any long-term care home and retirement home resident at that time, there's certain time limit that you have to either use the vaccine or discard it. So the hospital has a pool of key workers that are prioritized based on their work assignment, and those priority is based on their risk of acquiring COVID and then their risk of developing severe illness. If they meet those criteria, those extra vials or extra doses can be given to the hospital staff. And as we are coming and to the point when most of these long-term care home and retirement home workers who are offered the vaccine, and now the numbers are not getting that big, and you have these vaccines, and recognizing that the healthcare workers in those settings are also a priority. So some of these workers are getting that. I don't have the breakdown, but I think based on the priority identified by the ministry, I can say that, yep, they are an identified priority. And there is a prioritization matrix that each of these healthcare workers, they have to put those in those category to identify a risk. And if they are identified as a high risk based on that prioritization matrix, they can get the vaccine. But as I said, generally speaking, it's the people who have a highest risk of acquiring COVID disease, and then it's the healthcare workers who will have the highest chance of developing more severe disease if they contract COVID.
And I apologize once again if this has been asked, but any idea how many people in Windsor-Essex have received the vaccination already?
I don't have that complete number. I know the hospital is tracking their number. We are tracking our number, and we are sending it back to the ministry. But and they are the one who's keeping that information. So I can't. First of all, I don't have all the numbers, and at this point, I would be reluctant to share that number. It's better to come from the ministry.
Okay, and one final one for Teresa. Teresa, last week when we were talking about the vaccine for the long-term care and retirement homes, you talked about how it's voluntary and you were asking people not to turn it down. I guess since that time, do you know if anyone has turned down the vaccine?
So we do have people that have declined the consent. So as you know, you consent to having the vaccines. So there are people that have declined, that have not consented to the vaccine. I don't know the percentage. As you know, we're just starting to, we're completing our 7th home today, and we'll be able to have more information as we move forward. But there are some people that are declining.
Is that disappointing for you?
Everybody has their own, their own individual right to make their decisions. But I just want the residents, their family members, their substitute decision makers to have all the information they need to make the best decision. So if there's some question they have or some reason that's holding them back, we would ask that they reach out to our health unit and get the information they need to make the best decision for themselves, their loved ones. But that's the best we can do. Make sure that we have the most current information so they can make an informed decision.
Thank you.
Any questions from CTV?
Yes, good morning. Just looking for some clarification on the vaccination progress at the LTC homes. You mentioned 2 more homes today, so does that make 7 total now, and is that still on track with the initial rollout plan?
Yes, so we had a schedule that Dr. Ahmed talked about. Our schedule actually started on January 4th, and so we had our own internal schedule. We had been reaching out to the homes prior, to the last few days. And so now we're finalizing those schedules, and we are on track. And if homes are in a better position, if they feel that they are even able to vaccinate themselves, like their residents with their own staff, then they might maybe moved up in the schedule to get that to happen more quickly. But there are logistics and getting the resident lists, and as you know now that the remaining staff can get vaccinated on site as well as the caregivers to the residents. So it's a bigger group, and as they get all the consents and prepare for the vaccine rollout, if they're able to do it themselves, we'll move them up in the schedule, because then at that point we're delivering the vaccine based on completed consents and their readiness to use the COVAX system. So we're working very like a custom, plan for each long-term care home, but they are already, every home is scheduled.
So when the staff at the long-term care homes administers the vaccine, are they vaccinated themselves first and then they administer it at a later time?
Sorry, would they administer to themselves or to the resident? So they would do, the plan is they do their residents first, the caregivers and the staff, but they're typically doing them all in the same day or 2.
Right, but
sorry.
we had a call from someone yesterday that was concerned that a healthcare worker wasn't vaccinated themselves first before giving the vaccination to other people, I guess was the question I was getting at.
Well, that may be the case. The vaccination for staff in long-term care homes has been going on through the Pfizer rollout. So many of the people that are working in the homes that are wanting, that have, scheduled, had their vaccination, some have not. And so this opportunity is for the ability for them to be vaccinated on site at their own home. But that could be the case where they're vaccinating their residents before they get the vaccine if they weren't able to take part in the Pfizer rollout at this time. So that could be a case, but they will quickly, be able to have access as well. So I hope that will address whatever concern there is about that.
Okay, thank you.
Any questions from CBC?
Yes, good morning. When did work begin to set up these local parameters to get the vaccine to homes in outbreak? Was this a recent change, or has it been in the works for a while? And regardless, would it not have been possible to institute these parameters from the get-go?
Well, I think, as I said and acknowledged, that the vaccination, every time when you are thinking about who to vaccinate, how to vaccinate, and what's the effectiveness of these vaccination, what would be the right time for vaccination, what would be the indication for vaccination versus what would be the contraindication for these vaccination. When any of these vaccines are approved, there are certain indications for when to use it and how to use it. The challenge with the new vaccine is not everything is covered in terms of the research evidence. The clinical trials for many of these vaccines, they take a very defined group of people in terms of who they want to target and who they are specifically looking for from a vaccine effectiveness perspective. So there will always be some question that will be unanswered, and in the absence of those unanswered questions, we have to go back to the science, we have to go back to the immunology, we have to go back to the vaccinology to figure out, how these vaccines are used and what would be the criteria that would make the vaccine useful as opposed to rendering it ineffective, inefficient, or a waste of a vaccine when there would be other ways to maximize the effectiveness of these vaccines. So having said that, all of these consideration when we are thinking about our local work, obviously we have to see that what kind of recommendations coming from the different levels of the experts, and how we can use it for our region, and where are those gaps. Identifying those gaps and then working on those gaps was I think I can say that we've been working on it for, I don't know, maybe like 4 or 5 days now to come up to where we are right now. And this morning we felt comfortable to move forward. While there is still, I think there are some recommendations that may come later from the province or other bodies, but we feel, knowing where we are with respect to our cases, we feel comfortable knowing the signs of how the other vaccines affect. We felt that it's important to move forward, and to answer your question, obviously some of these decisions, we take time, we look at all the evidence, we consult, we use our own expertise, and so today we shared that.
Okay, just a follow-up question here. Samples were sent out to see if the new strain of COVID-19 from the UK is here. Windsor Regional does suspect that Windsor-Essex has it. Is there any update on the health unit's end on this? And if so, what would that mean for the region?
Well, I guess we can always suspect what could be happening when we are seeing some of the high rates of transmission. But again, going back to some of the basics, it's the virus, and we've been saying it right from the beginning. It's a virus which is spread by a droplet, and the mechanism is not changed. So the mechanism is still the same. The only thing that what would make it more challenging is maybe there were situations where you could have avoided the virus because of maybe less number of the actual viruses that you come in contact with. What we, in other words, we call the word is infective dose. And that infective dose can be high, that infective dose can be low. So if you have a low infective dose, that means the virus can easily infect you if you come in contact with it. So I see that from a scientific perspective. It's an interesting question to answer, that whether this is the same strain and then same strain. My question would be, would the vaccine would be effective for this strain or not? So that would be my public health rationale on public health question to it. But in terms of whether it is mutated, how quickly it's spreading, we have to go back to, have we done everything what we are doing from a public health control perspective by following all those recommendations or not? And if people are not following that recommendations to begin with, it doesn't matter what strain you're dealing with, it doesn't matter which kind of respiratory virus you're dealing with, it will continue to spread if it's in the community. So as much as it's a great question, but we are not directly involved in analyzing which strains that they are getting. If Public Health Ontario and the National Microbiology Lab, if they find a strain from Windsor-Essex, that if there's a different strain that they have found, they will definitely report it back to us. But at this time, my focus is, how do we get the virus in control, which is, again, the mechanism, it hasn't changed, it's still the same. How do we get the vaccine rollout very quickly to the community and get it into the people to build that immunity? So that's what our focus is right now.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. Just to clarify, actually Windsor General Hospital has sent out a release that states they vaccinated just under 3,000 people as of the end of the day on Monday. Do you have an estimate of how many that you may have vaccinated?
As I mentioned earlier, I think we'll let the ministry do that counting for us. We have not been given the permission to share that number broadly. All I can tell you about the going from homes to home, that how many homes that we have covered, and our plan is to, as we said, finish all the homes within the next 7 to 10 days, and then move on to the retirement home and move on to the next priority.
Okay, and that's 7 homes by the end of the day today, or 7 homes and then 2 additional ones today?
I'll let Teresa answer.
It's 7 homes at the end of today.
Okay, thank you.
Any further questions from the Windsor Star?
No, thank you.
AMA 100?
Sorry, just another clarification there, Teresa. Is that 7 long-term care homes, or is that combined with the retirement homes, or is the focus long-term care right now?
The focus is long-term care until for the first grouping. So that is the long-term care homes.
Okay, thank you.
Any further questions from CTV?
Yeah, just one. Quebec is headed into another lockdown with an 8 p.m. or 9 p.m. curfew. Do you think curfews are something that should be considered for Ontario or our region?
Well, I'll leave that decision to our politicians to make. I think from a public health perspective, what we have always said, that any opportunity, anything that brings people together, it increases the risk for COVID, and it really depends on the level of restriction that someone can put in. And there is a benefit when we are talking about, there's a public health benefit when we are talking about keeping people at home. But again, those are some of the decisions that our politicians have to make.
Okay, thank you.
Any further questions from CBC?
Yep, just 2 quick ones here. Teresa, off your comment there, you mentioned the focus is on long-term care. Why is that, considering there are outbreaks in retirement homes as well?
So the intent is to do long-term care and retirement homes, with the first grouping long-term care homes, recognizing that we do have some areas in Windsor where there's a long-term care home and a retirement home in the same home. So in those instances, we'll be doing 2 together. We did have some retirement homes that were already scheduled prior to the focus on long-term care initially. So we'll move forward with that as well. But the intent is to have both settings, both group homes completed this month. So I think the focus or the direction from the province was to start with long-term care homes. So we are moving forward with the direction we're given, but knowing that our intention is to do both as quickly as possible.
And just another quick one here. I noticed the outbreak at the Salvation Army Center of Hope is still in effect. Is there any update the health unit can provide on the status of that outbreak?
I don't have any further information on that. We do have meetings every day and go through all of the outbreaks, which we have quite a few, but the Salvation Army, I don't have any other information about them right now. Sorry.
So Sanjay, do you want to clarify like what exactly kind of update that you're looking for? All I can tell you is that they still have one new additional case that was reported to us yesterday, and there's a lot of work that's been happening in terms of assessing, doing the health assessment and monitoring all these people. So not entirely sure that what kind of update you're looking for.
Right, essentially on cases. Last time when we had asked, a couple days ago, you had mentioned you estimated it was about 5 cases. I was wondering if you had had cases grown. You mentioned 1 extra case there. Do you know what the official case count stands at?
I don't have that number right in front of me, and if you're really interested, send a note to Mike and we'll try to send that number.
Okay, sounds good, thank you.
Any further questions from Blackburn?
No, thank you.
Thank you, everyone.
Thank you.